Hello everyone, welcome to OBG Nursing. Today let's learn about per-abdominal examination. Okay, definition. So what is per-abdominal examination? It is a systematic physical assessment and a non-invasive bedside procedure of a pregnant woman's abdomen. What we do here, we evaluate the fetus growth, lie, presentation and well-being. Growth means the height of the fetus, the height of the fundus or the uterus indicates growth. So what is lie? Lie is how the baby is positioned in the uterus, whether it is a breech, transverse, diagonally or cephalic. And presentation is, it means is it the left occipital anterior or a right occipital posterior. And well-being is by we here check the baby's fetal heart rate. So this is the definition. So what is the purpose of doing per-abdominal examination? First is to estimate the gestational age of the pregnant mother. Two, it is to determine the growth, lie and presentation of the fetus, which we studied earlier in the definition. And number three is to assess the fetal well-being through fetal heart rate. Okay, so when to perform this assessment? We should also know when to do it, right? So the first is once the pregnancy reaches 24 weeks and beyond. Number two, before and during labor. Before means during ANC, antenatal care, and during labor. And number three, whenever there are complaints like pain, reduced fetal movement, etc. At that time also we need to do this assessment. Okay, moving on to preparation. First, take verbal consent, very important. Number two, ensure privacy of the mother. This is very important and it comes under respectful maternity care. Suppose a client's privacy is violated or she's been treated rudely, she can always take this matter to the higher to the hospital management and can also take a legal action. Number three, bladder should be emptied. Number four, she should be lying down in a supine position, head slightly elevated and legs kept straight. Number five, allow a companion. This also comes under respectful maternity care if she desires. Number six, maintain dignity and use respectful language. Okay, now steps of per-abdominal examination. So there are three steps: inspection, palpation and auscultation. In details we'll learn in the further slides. So okay, let's start with inspection. So inspection, first we need to observe first size, shape, feet and fetal movement. So in size, inspect whether the size is too big for its gestational age. That means if a mother is, according to her LMP, last menstruational period, if her gestational age is 26 weeks, suppose 27 weeks, whatever it is, but if it looks more than that, if the abdomen looks bigger than its gestational age, then we need to rule out two things. One, multiple pregnancy. Two, polyhydramnios. Okay, and then shape. In shape, see whether it is like if a mother is still 36 weeks, what happens is the shape of the abdomen looks oval shape. After that, once the mother is in term, that means 37, 38, 39 weeks, what happens is the flank is fuller. Okay, so you need to inspect even for a shape and fetal movement. During the inspection, you will also see at a times fetal movement also. So these are the things that you need to observe. One, the other thing is linea nigra. Linea nigra is the line between the abdomen. So the brownish line between the abdomen is called linea nigra and it is also a sign of pregnancy. Number three, stria gravidarum. Stria gravidarum is this, a kind of stretch marks in the abdomen. Here what do you need to see is check for any redness because of excessive itchingness, maybe if there is any redness, check for that. And scars, see whether there is any previous cesarean scars or not, or any lower abdominal um, uh, surgery been done. Inspect for that as well. Moving on to palpation. So in palpation, there are three types of palpation. One is the fundal palpation, and then lateral palpation, and then pelvic palpation. So now we'll learn about fundal palpation or fundal height. The purpose is to determine the gestational age of the fetus. So first, using your ulnar border of your hand, gently move your hands from ZP sternum to the fundus of the uterus, which means wherever the resistance you first feel. Okay, and then mark the place wherever the resistance you felt. Take a measuring tape and keep the place the measuring tape from the symphysis pubis till the area place where you felt the resistance. So if you have felt the resistance here, to keep the measuring tape till here, and then you measure it. So correlate with the weeks of gestation. One, that means 1 centimeter is equals to 1 week. Okay. Uh, Now lateral palpation. So what is the purpose of doing lateral palpation? It is to determine the fetal lie and to check the fetal heart rate. So fetal lie means whether it is cephalic or breech, or whether it is oblique, or whether it is transverse. This is the thing that we will be checking here. Here the position of the mother should be slightly, her knee should be slightly bent. So place both your hands at the either side of the abdomen and palpate it gently from top to bottom. If you are palpating at the right side, the left hand side should be holding the other side of the abdomen, and then you should palpate, and then vice versa, like you need to palpate both the side. So now here observe the difference in the texture, okay, and the movement. So what happens is, like, if it is smooth, if you find smooth and firm surfaces, that means it is back or spine, and if you find irregular or knobby, then it indicates that it is a limb, which is arm and legs. Okay. So now let's learn about pelvic grip or pelvic palpation. Pelvic palpation, we have two types of pelvic palpation, which is first pelvic grip and the second pelvic grip. Um, First pelvic grip, it is also called as Paulic grip, and the purpose of the pelvic grip, sorry, Paulic grip, is to identify the presenting part and the head engagement. So how do you identify the head engagement? By palatability test. We'll learn this. First, what do you need to do? Spread your dominating hand widely over the symphysis pubis. With the ulnar border of your hand and touching the symphysis pubis. Gently press the lower part of the uterus with your thumb and finger. Try to feel the presenting part between them. What is here? Which part of the baby uh, is here? Try to feel that. If it feels hard and round, then it is head. If it feels soft and round, then it is breech. Okay. If the presenting part is head, try to move it from side to side. Got it? If it cannot be moved, then that means the head is engaged. Now what is engaged? Engaged means the fetal head has descended into the mother's pelvis. Okay, it has descended into mother's pelvis. That is the reason why you are not able to move the baby's head. If it is movable, that means the head is not engaged. The head is still at the abdomen part. You have a space here, that is why you are able to move the baby's head. So that is why engaged and not engaged. So I hope you have understood what is engaged and what is not engaged. Okay, clear? Next is fourth maneuver or a second pelvic grip. The purpose is the same. It is to assess whether the head has been engaged or not. This is the another way of assessing the head engagement. So here, to do this technique, what you need to do is you have to face you have to face the foot end of the bed. You have to stand in such a way that you are facing towards the mother's foot. Okay, place both the place both the palm of your hand on the other side of the uterus with the finger held close together, pointing downwards and inward. Okay, downwards and inward, and palpate to recognize the presenting part, whatever it is. Okay, what part is it here? Okay, if the now listen carefully. If your finger diverts when you move downwards, if your finger diverts, that means the head is engaged. Okay, but if your hand converts, that means the head is not engaged. It is still it is not been part of the pelvis. It is still in the abdomen. Clear? The thing is about the fourth maneuver is if you are little confused or if you are not clear when you do the ballotable test in the first the one which we learned in the first pelvic grip. If you are not sure whether the head has been engaged or not, you can perform this technique, and this will give you a clear understanding whether whether the baby's head has been engaged or not. Okay, clear? So now let's. Okay, now auscultation. We learned about inspection, we learned about palpation, and now auscultation. So the importance or the purpose of doing auscultation is to check the fetal heart rate. Okay, so how do you do? We need to place the stethoscope or a bell of the stethoscope on the side of the uterus where the fetal back is felt. Side of the uterus where the fetal back or the spine is felt. Okay. Fetal heart sound are best heard midway between the umbilicus and the anterior superior iliac spine. You need to draw an imaginary line here between the umbilicus and the anterior superior iliac spine. You will hear the sound very clearly. Okay. So if it is a breech presentation, you will hear above the umbilicus. Above the umbilicus. If it is vertex presentation, symphatic presentation, then you will hear whichever side. You need to first find out which side the spine is or the back is. So there, what you need to do, you need to place the stethoscope or the bell of the stethoscope, whichever you are using, just the diagonally between the umbilicus and the anterior superior iliac spine. You need to draw an imaginary line and place the stethoscope there and listen to the fetal heart sound. Here, count the fetal heart rate full 1 minute. This is very important. You have to listen to the fetal heart rate for 1 full minute. Okay. I hope you have understood about per abdominal. Thank you. If you find it helpful, then please do share with your friends and do not forget to like and subscribe. Until then, see you in my next video.